Hi, this is Markeitha, and welcome back to Healthy Living. You can reach me at healthyliving.company. There at my website, you'll see several things. You'll see Keitha's egg toast and gumbo. You have to send me a message if you want the gumbo or the egg toast. The gumbo comes with hot water cornbread, rice. So I want to make it fresh for you, so you have to send me a message. You can also contact me here at the Next Level Studios at 310-549-1113. 310-549-1113. Now, if you missed the live broadcast, you can also go to the website and click on previous shows, and there you can see the previous shows anytime you want. So if somebody missed it, please, if they have children, have them come and watch the show today, because it's about the impact on children. Now, the producer of the show is T-Jams. That's T-J-A-M-Z, and you can reach him at tjamsmusic.com. There he writes the songs for the show. He has a whole host of songs there. You can write lyrics to it. You can send him back a message with the lyrics. He also does web design. So you can send him messages on his website, or you can contact him here at the Next Level Studios at 310-549-1113, 310-549-1113. Now, I get most of my information from the OSHA and the CDC website. The World Media is where I get the statistics for the ongoing updates for the show of how many people, cases, and deaths that we have around the world. Also, so let's get to that. As of today, April 11th, we currently have a confirmed cases worldwide, 136,493,694. Deaths, wow, we're almost at 3 million. We're at 2,946,073. That is way too much. Now, we do have several million that have recovered. 109,707,469 patients. Now, you never want to even get coronavirus, because even if you survive, you have long-term symptoms and sometimes permanent damage to your lungs and other organs. So you don't want to get it. Now, the U.S. is leading in cases and deaths. Currently, the U.S. has cases 31,879,293. Deaths 575,629. Now, Brazil is leading in cases. They're number 3, but they're second in deaths. So in cases, they have 13,525,364, and leading in second, I said second in the world, deaths, they have 351,469. That is really terrible. Now, COVID is caused by severe acute respiratory syndrome. It's the SARS-CoV-2. It's a new coronavirus. It was identified in December 2019. This is why we have COVID-19. Shows the origin of the date of the virus. It started in Wuhan, China. The World Health Organization declared a public health emergency, international, meaning all across the world. This was done. They declared it a problem in January, but then they declared a pandemic on March 11, 2020. It has spread to 219 countries and territories. The outbreak was linked to large seafood markets. That's what they think initially. According to Medscape on 4/29 this year, they went to Saigon Rudder, a joint China World Organization investigation study into COVID-19 has provided a credible answer to how the pandemic began, and more rigorous investigations are required. Now, this will be with and without the Beijing involvement. So, some of them have been pushing back, so the United States still thinks that they're suppressing the information and they're not making it all available to the scientists. Now, a joint study released last week said that the latest transmission route of the SARS coronavirus 2 involved bats and other wild animals. Many theories suggest an animal-to-animal spread, and then it started spreading to They started in live animal markets, but then it started spreading to person, from animals to person, then it's person to person. So that's where we are at this time, where we have person to person. Illness range from mild death symptom, mild to death. That's how severe it is. Symptoms are mild, moderate, severe, and to death. Okay, so there's different variations that can occur. Symptoms may appear within 2 to 14 days after exposure to the virus. The incubation period. The median incubation period for COVID-19 is 4 to 5 days. Most symptomatic people experience symptoms within 2 to 7 days after the exposure. Symptoms are wide-ranging and can be like flu symptoms, but I don't want you to mistakenly think you have the flu. Still contact your doctor if you have these symptoms. Fever, 100.4 or higher. Fatigue, cough, shortness of breath. Now, shortness of breath is never a flu symptom, so that's the difference. So make sure you contact your provider. Chills, reported shakes with chills. They say it's very violent and it's painful. Headaches, muscle and body aches, sore throat, nausea, vomiting. Also diarrhea, congestion, runny nose. New symptom recently more is hiccups. You can have it several days before even developing the coronavirus. Also, new loss of taste and smell. COVID can also cause severe respiratory illness. And these can send you to the hospital. So these are the emergency signs and symptoms when you know you need to call 911. Trouble breathing, persistent pain, pressure in your chest. You know, like someone's sitting on your chest, but no one's actually there. Can cause confusion. Even signs of discoloration like bluish, purple, and gray in a dark pigment skin individuals on their lips, their eyes, and their face. Now, who is more vulnerable? Well, you know, they used to say, you know, well, it is the top one, even though now it's decreasing in cases that, you know, if you're 65 and older and you have underlying medical condition, but everybody can get COVID. No one's exempt, no matter what age you are, including infants. Certain underlying medical conditions also include the risk of severe illness of the virus, of, you know, that can get you into the hospital. It can get you into hospitalizations with ICU. You can also get to where you have to be intubated, you know, with a respirator, and you can have also progressed to death. So this is serious. You can't play with COVID. It is not over yet. We have less than 20% of the population that's been fully vaccinated. And even after you're vaccinated with your second shots, it needs to have at least 14 days after that second shot for you to be protected. Some of the conditions, the underlying conditions include heart disease, stroke, if you have hypertension, chronic lung disease, asthma. Watch your children, especially if they have asthma, because they tend to de-escalate and get serious. Actually, they get more serious when they're children with asthma. They die very quickly, so I need you to watch them. There are cases where they died very quickly, so don't hesitate, don't wait. Just take your kids in. They will protect you and your child from COVID. The medical staff are professionals and they know how to protect you. So don't hesitate. Get your child in. Also, if there's COPD, chronic kidney disease, sickle cell anemia, liver, cancer, autoimmune suppressive disorders. If you just had chemotherapy, it decreases your immune ability. Also, HIV, leukemia, lupus, sarcoidosis, cancer. Also, type 1 diabetes, also type 2. Type 1 is when you're totally insulin dependent, and type 2 is some oral medications or diet. So you have to be careful. No smoking. Also, increased risk for if you're pregnant, and severe obesity. So being overweight is a problem. So try to, eat more healthy, exercise every day, at least an hour, to make sure that you're losing weight and not gaining weight. Now, children are returning to schools. I personally don't agree with it, but I'm here to give you the information so you can have what you need to protect your children when they go back to school. According to Medscape, children likely the leading edge in spread of COVID 19 variants. Now, we've been talking about these variants that are happening. There's B117 and several others. These are causing problems. Now, Brenda Goodman, as of April the 1st, 2021, she's a public health official in the Mideast and Northeast, are sounding the alarm about sweeping new increases of COVID cases in children. Yes, children. At first, everybody thought they were immune, but they're not. I've been telling you guys this for a long time if you have been following me and watching my broadcast. So now the alarm is with children. Increase seems to be driven by greater circulation of more contagious variants, such as children and teens have returned to in-person activities like sports, especially sports, parties, and classes. I can just tell you from my 46 years in the business, I've never seen a dramatic transformation in kids like we're going through right now. Younger children, said Michael Osterheim, PhD, who directs the Center of Infection Disease Research and Policy at the University of Minnesota, Minneapolis. In earlier surges, children, especially young children, played only a minor role in transmitting the infection. When they were diagnosed with COVID, their symptoms tend to be mild and even absent. And for reasons that aren't well understood, they haven't usually been the first cases in the household or clusters. The governor in some hard-hit states are pleading with the pandemic warrior public to keep your mask wearing and social distance. Please follow the restrictions and avoid unnecessary travel and large gathering in order to protect yourself and from also in-person classes as well. So we have to follow the guidelines. People are, they tell you not to take a plane, and we're back to the peak of travel for the spring break before the pandemic. That is just unacceptable. This is a problem. In Michigan, many schools reopen and youth sports resume just as more contagious B117 that I mentioned earlier, the variant, is spreading widely. Their cases are rising among all age groups, but the largest number of new COVID cases is among children ages 10 to 19. The first time this has happened since the start of the pandemic. So I want you guys to hear this and understand this. This is the variants that are coming. They're already here, and this is what I've been talking about for several months. It's not over. Over the past month, incidence in the age group has more than doubled in the state. Cases among the young children, infants through 9 years old, are also going up, increasing by more than 230%. Did you hear that? 230% increase in these children. This has been since February the 19th. According to the data from the Michigan Department of Health and Human Services, the increase have prompted some schools to pause in-person learning for a time after spring break to slow transmission. According to Natasha Bagdasarian, MD, senior public health physician with the Michigan Health Department in Ann Arbor in Minnesota, on the recent call with reporters, Ruth Linfield, doctor, state epidemiologist, said that the B117 variant, which has rapidly risen in the state, has a higher attack rate among children than earlier versions of the virus, meaning they're more likely to be infected when exposed. Now, this is in Massachusetts, Minnesota. Now, Massachusetts has the 5th highest number of recorded B117 cases in the United States, according to the CDC databases. Although most COVID cases in children or teens are mild, the disease can be severe for those who have underlying medical conditions. Even in healthy kids, it can trigger a serious post-viral syndrome called multisystem system inflammatory syndrome. This is in children. I did a whole show on that, so I'm going to go over some of this for you guys too. Now, this causes hospitalization in those particular children. Emerging studies show that children, like adults, can develop lingering symptoms long after COVID. The recent data from the United Kingdom shows 10 to 15% of children younger than 16 infected with COVID will still have at least one symptom 5 weeks later. This is after they're supposed to be done with their COVID. And so they have these long symptoms just like the adults are having now. Osterheim said that it remains to be seen whether more cases in children will also mean a rise in more serious outcomes for kids. And this has happened in Europe and Israel. In Israel, the B117 variant of the COVID arrived at the end of December last year and began dominating in January. By the end of January, Dr. Hassan Aaron Kassim Medical Center in the Jerusalem had 4 patients in its nearly open pediatric COVID unit, ICU, intensive care unit. They range from ages of 13 days are infants, 13 days, not months, 13 days to 2 years. This, again, is in Jerusalem. By early February, Ministry of Health warned that the country's doctors to prepare for imminent upward trends in pediatric COVID cases. That's really bad. We have to watch our children. This is why I'm doing this show. They notified hospitals to be ready to open more ICU beds for children with COVID-19, according to Dr. Cohen, head of the laboratory and immunotherapy at the Bar-Ilan University in Ramat Gan, Israel. Now, on Wednesday, the French president, Emmanuel Macron, ordered France into its 3rd national lockdown and closed schools for 3 weeks to try to hold off a 3rd wave of the COVID-19. Now, he had been a strong defender keeping the schools open, but because of the increased surge in cases, he had to shut down because it was necessary. So the schools are shut down there. Now, while COVID-19 fatality rates in children are much lower than they are in adults, but at least 279 children have died across the U.S. since the start of the pandemic. Now, we don't want anybody to die, let alone a child. The largest number of confirmed pediatric deaths recorded during any previous 10 flu seasons was 188. So that was 10 years worth of flu, and they had 188. The coronavirus had 279, and that's in one season. So COVID still remains to be a higher cause of death for children versus the flu. So you have 1 year versus 10 years. That's significant. Now, this is according to the CDC. She was thrilled to hear that the recent news that Pfizer said that the Pfizer vaccine is working well with children from 12 to 15. That's what our CDC director is stating. We really want parents and family members who are eligible to be vaccinated should get vaccinated. This way you can protect the children until they can be vaccinated. Now, adults, we also got to make sure that you're not going to these crowded games and parties and movies and all this other stuff, because you're going to bring it back to your children now because the variant is out there. So you have to protect yourself, and this is what she's encouraging in order to protect the children, your children. Children with COVID-19 can get multi-inflammatory syndrome, and this is what I was saying to you earlier. It's a serious condition. It affects several body parts, such as major organs like heart, their lungs, blood vessels, kidneys, digestive system, brain, skin, or eyes become severely inflamed. So basically it attacks their body. it attacks their little bodies. Evidence indicates that many of these children were infected with coronavirus 19 in the past, as shown by positive antibody test results, suggesting that multi-symptom inflammatory syndrome is caused by an excessive immune response related to COVID-19. And this is also why adults tend to die, because their bodies overreact to it, and this is why their systems start failing and it attacks everything. Possible signs and symptoms include fever that lasts more than 24 hours or longer. So check your kids' temperature. Sometimes kids, if they're used to running around but you see them laying down, you need to check their temperature. They may have a fever. Kids don't lay down, so check them if they're laying down. They may have vomiting and diarrhea, and you know that's not normal for children. They may even get pain in their stomach. Children sometimes, when they're really young, they'll hold their stomach, to let you know that their stomach is hurting. So watch for the nonverbal clues as well. They get skin rashes. They get this fast heartbeat, rapid breathing. And when your child is in trouble, or any adults too, if they're in trouble, normally you don't see us breathing. But when you're having a hard time breathing, you can see these other muscles and shoulders getting involved, and you can actually see them taking in and out of breath. That means they're having shortness of breath. That's a problem. Now, they get red eyes or swelling in the lips and tongue. Usually the tongue swells really, gets really like a beefy red, kind of like a strawberry. It looks like a strawberry. Feeling unusually tired, redness and swelling of their hands and feet, especially you can see it in the palms of their hands and the bottom of their feet. They get headaches. Now, what child gets headaches? Kids not supposed to get headaches, right? So that's a sign. They get dizzy and lightheadedness. Their lymph nodes may be enlarged. You can just kind of run your fingers along the tip of their ears and along their neck, and if you can feel something protruding, those are their lymph nodes. So you need to contact your doctor right away and let your doctor know what your child's symptoms are. Don't hesitate. Children die quicker than adults because they're smaller and they're more susceptible. Now, emergency signs of the multi-symptom inflammatory syndrome includes inability to wake your child up. If you can't wake them up, that's a problem. Call 911. Difficulty breathing. New confusion. You tell them something and they're not responding, or they appear confused. Bluish lips or face. Like I say, darker complexions, or maybe purplish or gray. Severe stomach pain. If they're rolling around and crying that they're in pain, that's a problem. You need to call 911. Make sure you don't hesitate. Some parents waited, we'll do this tomorrow, and their child died. So you don't want to wait too late. You want to take your child in when you see those symptoms. If your child is not severely ill but shows some signs and symptoms of this multi-inflammatory syndrome, you need to contact your doctor. The best thing to do, even if they have a few symptoms, still contact your doctor. Your children should not be having symptoms. If they have any symptom, contact the primary doctor. If they have those severe symptoms, you can't wake them, they have a hard time breathing, call 911. Don't hesitate. For more information before the variant. Now, this information was before the variant. So this is what I'm going to let you know about. According to the Mayo Clinic, this is related to children. This is before the variant. Now, the variant is much worse now. This is before. This is the change, so you can see what happened. According to the Mayo Clinic, how likely is your child to become sick with COVID? Well, all children can get the virus and cause COVID. They do not become sick as often as adults. Most children have mild symptoms or no symptoms. According to the American Academy of Pediatrics and Children's Hospital Association, in the United States, they represent about 13% of all COVID-19 cases. Research suggests that children younger than ages 10 to 14 are less likely to become infected with the virus, and more people that are 20 and older gets more COVID virus. However, I told you about the variant, so it's more serious now, so they can. So all of that goes out the door. But even before then, they also stated that children can still be in intensive care if they get the multi-system syndrome. So multi-inflammatory system syndrome. So I still want you to know it was already there, but it's worse now because of the variant B117. Now, however, even before the variant, if your children have underlying medical condition, it will increase their chances of having the multi-system inflammatory syndrome if they have underlying conditions such as obesity. And we have an epidemic in obesity even before the pandemic. So we got to get these children healthy foods. You got to get them healthy eating habits. You got to get them to exercise so they're losing weight. If they have diabetes, asthma, they're at a higher risk of serious COVID infections. Children that have congenital heart disease, genetic conditions affecting nervous systems or metabolic systems, are high risk for the serious COVID-19 symptoms and problems that may warrant them to go to hospital and maybe ICU. So we want to make sure that you guys are watching your children. Also, another common problem is inhalers. Make sure your children's inhalers are not expired. Usually you can look at the canister and it has a black area there and it tells you the date that it expires. You want to make sure your albuterol inhalers are not expired, or if you have other routine medication, make sure it's not expired. You can count the count. It's on the back of the inhaler on the bottom. It tells you how many puffs are still available. So make sure that it's not expired. And if they had it in the past, make sure you keep it current, okay, because you want this available. Research also suggests disproportionate higher rates of COVID-19 in Hispanic and black, non-Hispanic, meaning Hispanics and black children than white. So we still have a disparity. Brown and black have a higher disparity no matter if it's children or adults. Infants, children, teens, or adults. That's just what the disparity is, and it's really sad. I'll be glad when we can fix that problem. Why do children react differently to COVID? This is some of the reasons. It's not really clear yet, but they have some theories of how come they don't respond as worse. But the variant is a whole different animal. But some of the past reasons they think, because since children get colds, their immunity system might be primed and they might be already prepared because they get multiple colds from each other because they go to school to each other, right? So that could be why. It's also possible that the children's immune system interact with the virus differently than do adult immune system. Some adults are getting sick because their immune system seems to overreact to the virus, causing more damage to their body. This means less likely to happen in children. But the variant is new, so this is a whole nother different animal, okay? Now, I'm just giving you some reasons based on research, what they have discovered so far. How are babies affected by COVID-19? Now, with the new information, you can see that with the variant B117, everybody's affected from 3 days even to 2 years old. So those are babies and very young children. But this is the history of why they think that they're less likely. Babies under age 1 might be at higher risk due to severe COVID than other children. This is likely due to their immature immune system. So this is probably why that they're more susceptible of getting COVID variant when you're 3 days to 2 years, because their immune system is underdeveloped. Now, this will cause likely for them to have breathing issues with respiratory virus infections. Newborns can become infected with viruses caused by COVID-19 during childbirth, meaning from their mom, or by exposure to sick caregivers after the delivery. So if someone's sick, you need to make sure you ask them before they come around your baby. But you shouldn't be allowing people in your house that's not vaccinated, fully vaccinated, and you need to ask question, is there anybody in the house that's sick? because you don't want them coming to your house if they're sick. I know you love them, but if they're sick, they should not come to your home. If the COVID-19 or other waiting for test results due to symptoms, is recommended that during hospitalization after childbirth that you wear a cloth mask, have clean hands when caring for your newborn. Keeping your newborn's crib by your bed while you are in the hospital is okay, but it is also recommended that you maintain a reasonable distance from your baby when possible. When these steps are taken, the risk of the newborn becoming infected with COVID the virus is lower. So you would follow the doctors and the nurses' instructions while you're in the hospital. They will guide you along the way. If you are severely ill with COVID-19, you might need to be temporarily separated from your newborn. Infants who have COVID-19 or who cannot be tested to have no symptoms might be DC from the hospital, discharged from the hospital if they don't have any symptoms, if they're young, depending on the circumstance. It's recommended that the baby and caregiver wear face masks and wash their hands to prevent themselves from, passing it on to each other, because mothers and babies are close. So even before COVID, you want to make sure you keep your hands very clean, but more so now. But wear your mask if you have it. Follow your provider's instructions. You may need frequent follow-up with your baby care providers needed by phone or virtual visits or in-office visits for 14 days. Infants who test negative for COVID can be sent home from the hospital. On April 9, 2021, this year, Dr. Raquel Walensky, the director of the Center of Disease Control Prevention, discussed an increase in coronavirus cases due to youth sports. So this is another confirmation of the increases. This was in Michigan and Minnesota that are also increasing numbers for the cases linked to B117. This is the variant of COVID it's causing in various settings. There are concerns about transmission in youth sports. They're doing their sports now, so they're close, they're blowing, breathing heavily, tired, sweating, a lot of physical contact. And also in both club sports as well as sports affiliated in schools. Now, what's happening in Michigan and Minnesota is similar to what is seen across the country. Increasing reports of cases associated with youth sports. As cases increase in the community, we expect cases identified in schools may also increase. This is not necessarily indicative of school-based transmission. We have not yet seen evidence of significant transmission of COVID within the schools when schools have fully implemented the CDC mitigation guidelines. CDC has also awarded $10 billion through the American Red Cross the plan to support COVID testing in schools across the country. Being able to rapidly identify new cases amongst your students, your children, will help them slow the spread of COVID-19, while we're systematically working on expanding equity across for all vaccines for everyone. So we did get the report that, like I said, Pfizer is safe now for children 12 and older. So that's a good thing. So we're waiting for that to happen. Every state will have access to millions of dollars to step up screening programs to aid an additional layer of protection for schools, teachers, and students. This funding can be used to be testing teachers, staff, students, or anyone with any symptoms of COVID, those who may have been exposed to the virus, and to establish substantiated screening process across the school systems. We strongly encourage parents and staff and students to participate to keep our children and our staff safe in schools. So please participate in these programs. The initiatives, along with strict adherence to public health prevention precautions and getting COVID-19 vaccines, will help us turn the corner on the pandemic. So this is how the parents can protect their children, by getting the vaccine when they're protected, not gathering outside your home with others and going to these huge events where people don't wear masks. It's not over yet. It's not over. There is a COVID-19 vaccine through Pfizer that has been approved for children as young as 12. So that is fantastic. We're waiting on those different okays, and it should happen. This was announced on March 31st. So they're working on including, some states already have implemented the fact that anyone 16 or older can now be vaccinated as well. So when your number comes up, please get in line and get your vaccine. Now, the study shows that it was included 2,260 children and adolescents ages 12 to 15. This was the trial for the Pfizer. So this is the percentages. This is the Pfizer. And so they have proven that it was effective. Okay, hi everyone. So I'm going to show you some exercises you can do at home to help you with losing weight. So we're going to do lying, sitting, and standing. So I'm going to give you different ones and you can rotate. So if you're a beginner, you can have your back against your couch or the back of your bedboard, and you can start there. And then just make sure whenever you're doing it, you're holding your abs in and you're working your arms as well. Get a little bit more advanced, you scoot down a little bit. I usually do at least 3 sets of 10s. If you're a beginner, you might have to do 3 sets of 5. And then eventually, you go all the way. And remember, you got to hold your abs in whenever you're doing any exercises. Okay, let's get some more on the floor. Okay, so, alrighty. So on the floor, you can open your knees, bend them and open. So what you can do is just simply open and close. That's for the inner fat right there. That helps that area. So you can do that. You can also do pelvic tilts by putting the palms of your hands down, face down. And then remember, always holding your abs and lift. Now you can do reps of 30, or you can hold to the count of 30. You can do so, whichever one you're more comfortable with. Now, when you get more advanced, you can hold it up and then slowly slide down while you're holding up your buttocks. That also increases your core, which is your abs, your buttocks, and your thighs. So you slowly go down while you're holding yourself up. Okay? So you can do that too. Now, you can also have your legs apart and just do the scissors. You can open and close, or you can lift up and cross, right? You can do that. You can lift your legs. You can do one at a time. You can do low lifts together until you can go higher, 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 and then higher. So it's up to you. But remember, you got to always hold your abs in whenever you're doing the exercise. Okay? Now, let's do some sides. You can get your elastic band, put it above your knee, and you can actually make it tighter. So then there's more resistance. Now the other thing you want to do is you want to make sure that when you're doing this exercise that you roll your hip forward. So when I reach, it reminds me to roll my hip forward. So then you can hold your abs and you can do lifts here, 3 sets of 10s, and then you can go back and do 3 sets of 10s. And then remember, you got to do it on both sides, not just one side. I'm just demonstrating it, but do it on both sides. Okay? So you have that. Now another one that's good for your back, the back of your thighs, those cottage cheese thighs, and that back fat. Get on your tummy, and what you can do is raise both your legs up. If you can't do both, do one, but it's better to do both if you can. If you can't go all the way, go where you can go. If you have knee pain, you might want to go low until you can get higher, but eventually go all the way, right? So those are good. So now we're going to do some standing. Okay. So one thing we can do standing, okay, so what we can do is here standing, to develop your core, you can, get something stable you can hold on to until you get used to it. And then what you want to do is hold yourself up on one leg, because you want to use your core and your thigh and your buttocks to hold you up. So do that for 30 seconds. And you make sure you want to do both. Okay, so until you get used to it, get next to something that you can hold on to until you can get used to holding your balance. Another thing you can do is side leg lifts, right? Wherever you can go, so you can go higher, right? And then remember, it's both sides. Another thing you can do is lifts, so that you lift up on the ball of your foot. So you want to lift all the way up in the ball. Now, if you can't get there without holding, you might have to hold on something too until you get used to the lifts, right? Because you got to go all the way up to the ball of your foot, the bottom of your foot, right? Now, there's little ones you can do, shorties. You can do that too, but it's better to go all the way up. And a lot of times you can do this. I usually do this when I'm brushing my teeth in the morning. So you can do that, right? Now, another thing you can do, I call these standing sit-ups, where you open your legs. And now if you have back problems, you have to go slowly. Don't go too fast, because then you'll get back spasm. So you want to go slowly. Now, if you can't go all the way, then go where you can go. Your knee, whether it's your calf, your ankle, the top of your feet, and then the bottom. This is also a good one at the end to stretch out if you know, for your back. It's a good one to do. Hold for 30 seconds. Also, I want you to go from side to side too. Mix it up a little bit. So you got this, and then you're going to go side and side, right? Remember, you got to use your arms too. Let them go up and down too as well. Now, another thing you can do, you can, march in place. Got your weights, right? So then you can work your arms, right? Now, if you don't have weights, no problem. Get you some water bottles or canned fruit, and you'll be just fine, right? It doesn't matter. You don't have to go spend a bunch of money on something just to work out. You just work out. That's how you do it. Now we're going to do stuff sitting down. Let's do stuff sitting. You can also do, jumping jacks. These are good too. I know Michelle Obama does it a lot. So you can do that too while you're standing. Okay? Now, do some stuff sitting. So I'm giving you a variety of different things to do because you have to change it up. Because your body gets used to certain exercises, so you got to rotate them out. And it works. It really works. Now, stuff you can do while you're sitting. The same thing, we have where you get in this inner thigh, right? The inner thigh fat. So what you're going to do is the same thing. You're just going to open and close. Then you saw that Thigh Master, remember that? They put it through there and you close and open with resistance. You can do that too, but you could do it to get some resistance by putting on a resistance band. So it can give you a little bit more resistance when you get a little stronger. So it'll be a little harder, but what you want to do is make sure you're guiding it out and in slowly, because then that's better for you than you trying to just collapse it. It makes you stronger when you can hold it and guide it in and out slowly, if you want to get to the resistive band. Otherwise, you can just start at the beginning without the resistive band. Right? Now, another thing you can do the scissors too, where you crisscross, right? You can do that. Another thing that I kind of like for the top of the thigh is you can even do this at work when you take a break. You can hold it up, hold both your legs up, and then point your toes and bring them back up. Point them and bring them back out. Do it for a count of 30. And you can do that several reps. And you'll feel it here in your thighs. So you're working your calves and you're working your thighs. And remember, you're working your abs because you hold it in your ab. Okay, so you can do that. Now, another thing you can do is the 3 points. Like you lift up, straighten out, bend up, and down. Actually, 4 points. So lift up, straighten out, bend it back, and down. Straighten up, out. So you can do those as well. Now, you can also do where you have little lifts, right? So you can lift up 1 foot, 1 leg. You can lift them up individually, right? You can lift them up. Trust me, you're going to feel this, so don't think it doesn't work. It does. Now, another thing you do is you can do doubles where you lift up together, holding your abs, and lift up, right? Lift up. Holding your abs whenever you do it. This is working the lower part of your abs. You want to make sure you keep your back also pushed back to the back of the chair when you do this lift, right? Now, you can also do the running marches. I call them running marches. While you're sitting, you get your weights, because all you're doing is you're lifting up on your toes. So you can do them individually. So you have a running like march, and then you can do them together, right? Right? While you're working your weights, right? Now, the other thing I want to remind you about is the chair sit-ups. So, same principle, except you're sitting. So you're going to go down instead. So what you do is you go down this way, right? Same thing. Pull your abs in. Work your arms. Straighten them out. Close them in. Then you want to do the same thing. You want to go to the side, right? And try not to twist. Go to the side, right? Go to the side, right? So, another thing to do to help work your arms, you can get your retention band tied in the middle, put both your hands there, and you can just do some biceps, some curls, right? Now, if you have weights, you can do that while you're pedaling or exercise, and then you just rotate, right? And then to make it harder, you can pull your legs further apart and make it a little harder by putting more tension on the band, which causes more strength for you to hold the band apart while you're doing your curls, right? You can do that. Okay. Now, another thing I want to introduce you to is my QB. It's a peddler. You don't have to, spend that much money. You can get some that are cheaper. They're little peddlers. Peddler. This one, if you have knee problems, it's easier on your knees, and you can just. It has a intensity where you can range it. You can make it stronger and lighter. It has a dial on it, and at the top, it has a speedometer. It tells you how far you go. So while you're watching your favorite TV show, you can be exercising and pedaling. So, like if you watch Flash or Queen Sugar or whatever your favorite show is, by the time you get to about 3 commercials, I think you're about 30 minutes through. And if you do the whole show, you've done an hour. That's impressive. You can also put it in reverse, so it goes backwards as well. So you want to do some backwards, and you want to do some forward pedaling as well. So you can do that while you're sitting there watching your favorite program. Now, I want to make sure that you guys know how to protect yourself. You want to make sure you increase your fiber, not your fiber, your immune system to build it. You eat almonds, you eat cashews, broccoli, blackberries, avocados. Man, avocados are great, right? Avocados is a fantastic vegetable. it not only helps to build the immune system, it also has a high acid content, and the coronavirus does not like the high acid content. So the avocado is both acid as well as building the immune system. Now, also for the increased acid content, you have lemons. You have lemons, oranges, limes, pineapples. All of these things are great for you to drink or to eat to increase the acid. Also build your immune system. Also, if you don't have those things, which anybody should be able to get them now online because everybody has online grocery, you can take zinc as well, which will help build your immunity, as well as garlic is very good for your immunity. So if you're not going to eat a bunch of garlic cloves or every day, then you can also take garlic supplements. Also take B complex to help make sure I keep my red cells going, my folic acid. All of these have all the important B vitamins, the thiamine. All of this is in the B complex. So that helps keep your immune system built up as well. Everybody's seen a lot of the research, how proven that vitamin C is great for the immune system. So you want to make sure you get the vitamin C. Also, vitamin D. I usually get mine with the calcium because it helps to pick up the vitamin D. So this is proven research that vitamin D and vitamin C helps patients with coronavirus, even the ones with severe coronavirus. They found out that they were severely deficient in vitamin D. So when they gave them vitamin D supplements, they got better. So this is proven research that it does help you build a better immune. So might as well start getting used to doing that to help protect yourself. Now, you want to make sure that also there's proven research that gargling every morning, when you first get up, just cough a little bit and then gargle with the mouthwash. That also has been proven in research that it helps the coronavirus. So you want to do that with the mouthwash. They're finding out that it's not so much transmission with things that are on different items like packagings and stuff like that, but there's still a small percentage. So I still would suggest that you clean your items, your mail, wash your hands, wipe down your products that you bring into the home like groceries and things like that. You, instead of buying a bunch of products, you can make your own bleach spray. All you need is a third of the bleach and the rest is water. So then you have your own way of having replenishing your bleach spray. Also, you can use antibacterial soap on a towel to wipe down your stuff that you bring in from the stores. You want to be mindful of money because money has been touched by a lot of different people and it was accumulated very nasty. So if you handle money, and you can also wash your money, it's proven, but you want to make sure after you handle it, you wash your hands. You handle mail or your groceries or anything coming in, you wash your hands. Make sure that you wash your hands anyway. If you think you might not have washed your hands, then wash them again. It's better to be safe than sorry. Teach your children to wash their hands. Make sure it's at least 20 seconds. Teach them to sing Twinkle Twinkle Little Star or Happy Birthday song. Make sure when you spray on the waterless soap is 60% at least alcohol, and you keep wiping your hands and washing your hands until it dries. Don't put it on your hand and then wipe it off on your clothes. You're not doing yourself any good because you need the friction and you need it to really get in there in the grooves of your pores of your skin to clean it very well. You want to make sure you teach them to wash all the way to the fingertips, the back of their hands, under their nails. You want to get that good cleaning. Keep your nails low so they're easier to clean as well. Also for nasal rinsing, I have the Netimed where, there's other products online where there's a pre-package in and you can fill it to the line. Use warm water, not cold, and you can wash out your sinuses. This is very good. It helps to clean your sinuses out. Now also, we want to make sure that you have on 2 masks. Well, it's better to have at least one K95 or N95. Doesn't matter. Put it on. Wear it. Make sure you take your side of your fingers and put it on the side of your nose to make sure it fits. So you want to press in there. You also want to cover it with another cloth mask or non-medical mask. It's better to have a tight fit. You don't want any spaces on the side where the virus can sneak into. Also recommend, so wear your mask. Also recommend that you get some goggles. You get the kind that are fog free and the kind that are not vented, because this protects you on the side. A lot of people say, oh, I can wear my glasses or my contacts, but no, that's not full protection. You don't want it to come into the side. And that's why they recommend double mask wearing, so that there's no gaps in between your masks. So it's not over, people. I want you to protect yourself. You can order you some goggles. Make sure they're fog free. And they're not the vented ones. Either indirect venting or no venting is the best goggles for you to buy if you're buying online. So make sure you have that fog free. Also, if your goggles are fogging up, then you need to do another fit press against your nose to make sure it's tightly fitted so your goggles don't fog up. So if you don't have cloth masks or the money, hey, you know what? Get you a piece of cloth. You don't have to buy it. There's no excuse why you can't have a mask. Everyone can do this. So let me show you right quick. You can even make it out of a paper towel too. So I'm going to show you right quick so you know how to make a mask if you haven't seen my shows before. So all you need is a square piece of material, like so. Even cut off the bottom of your t-shirt into a square, and then you fold it in half, right? You fold down each side to fit towards the middle. And then what you do is you get a either rubber band or one of the little rubbers for the hair women that you guys wear. Put it on the end, and you fold it down into the center. You take another one for the other end and do the same thing. Put the rubber band on and fold this down to the center. Depending on the size of mask you want, depends on how far you fold it down. And then you grab the rubber band parts and you put it on your ear. So now you have a mask that you can wear, that you didn't spend any money on. So you don't have to have money to have a mask. You can make your own, and it won't cost you anything. Now, if you don't happen to have material, it can be done with paper towels. Okay, so what I did is I got 2 pieces of paper towel, folded them together. We're going to do the same process. Fold them down on each end, right? Fold them down. And then you're going to put the rubber bands on each end of it, just like you did the cloth one. Fold it down. You might have to hold it. Depends on the length of the paper towel, but that's okay. You fold it down. And you do the same thing. You grab the rubber band parts. You put it on your ear. And you have a mask. It's easy to do. So there's no reason why you can't mask and you can't double mask to protect yourself. You want to make sure there's no openings inside on the side of your face so that air can get into it, because it's an airborne transmitted disease. I don't care what anybody say. It's airborne transmitted. You sneeze, you cough, and it can travel up to 22 feet in 90 seconds. So even if they have 25 or 50 capacity for indoor activities, you only need one person for that virus to travel around and then infect multiple people. So I don't really agree with those different specifications right now. But if you're going to go, protect yourself and wear your mask. I would not go into any type of building where I'm going to be eating. That's just my preference to stay safe. If you go inside, that increases your possibility of getting exposed and contacting the virus. You want to make sure you wear your goggles as well. So double mask, wear your goggles, stay 6 feet or more apart, Uh, Also, make sure you take some waterless soap with you so you can wash your hands. If you don't have the money for waterless soap, you get the antibacterial soap. Get you a cloth. Get it. Put the soap on it, lathered up. Put it in a plastic sandwich bag, and you can wipe your hands on that. So there's many ways that you can protect yourself. So that's the most important thing, is to make sure you protect yourself. Now that kids have been approved to get the vaccine from Pfizer, so a lot of states have already beginning to open the vaccines up starting next week to 16 and older. Now I think once the Pfizer vaccine is on the market for the kids, it's already been approved. Hopefully then it'll be for 12 and up. Okay, but you still got to protect your young children. Remember I said that they can get coronavirus now with the new variant B.1.1.7. If you want to contact me, you contact me at healthyliving.company. Healthyliving.company was my website. If you missed the live broadcast, please tell your friends and family watch it. Click on the previous tab. You can send me messages there or contact me here at the Next Level Studios at 310-549-1113. 310-549-1113. Also, the producers T Jams, you can contact him at tjammusic.com. TJAMZ. You can send him messages. You can also contact him here at the Next Level Studios at 310-549-1113. Okay, stay safe. Protect your children. Watch your children. Get your vaccines when it's your turn. And I'll see you in a couple of weeks. Wear your mask. Wear your goggles. Wash your hands. Social distance. Okay, bye-bye. Get your exercises.